Yes, so very good evening to my dear students. Wonderful evening with you people. Post exam, no tension, no worries, totally relaxed. So, here I have brought you pharmacology recall questions which were asked probably in your June exam. And if we talk about the quality of questions and the extent of difficulty, as per the feedback which I have got from the students, I must say, although the questions were easy, they asked the very simple concepts, straightforward concepts they have asked, but they have asked in a twisted manner. Instead of asking a one-liner questions, they have asked questions in a clinical cases. So they've given a statement of around 3 to 4 lines. And after these 3 to 4 lines, they have just asked a simple one-liner questions. So students who have kept their nerves control, they marked it correctly. So many of the students have got around 85 to 90% correct answers. And few of the students got confused because of the length of these statements which they have given in the exam. But overall, it was a kind of a medium level exam. The difficulty level is medium. And if you have studied pharmacology at least 1 or 2 times for your preparations, during your preparations, so I think you would be able to crack this exam. You can easily secure around 60 to 70% marks in this exam. So let's start with the questions. Now, before starting the questions, one more thing. All these questions which I have able to write over here is just on the basis of feedback which I have got from the few students, right? So there might be some few things over here which are not actually be there in the exam. So this is a live session, so I want that you people give me the feedback in between, right? So keep this session interactive, so that even I will get a few more options out of it, and we can discuss this paper in these questions in detail. Yes, so I can see that around students who are online, around 30 or 40 students who are online. So Dipender Singh Chahal, Niyasat Ali, good evening. I hope you people have done your exam well. So let's start with the question number 1. So like we discussed in our top 25 questions of pharmacology series in MIST, we discussed as a question number 1 that this year anti-glaucoma drugs can be asked, and so here is a question in front of you. They've asked on 2 questions on anti-glaucoma drug. The first question is, a patient is suffering from glaucoma. A patient is suffering from glaucoma, and also that patient is a case of bronchial asthma. So patient is a case of glaucoma, suffering from bronchial asthma as well. Now, which anti-glaucoma drug should be avoided in this patient? So which anti-glaucoma drug should be avoided in this patient? So the answer of this question was timolol. So please remember, timolol is a beta blocker, and it's a non-selective beta blocker. So we discussed during our lectures, it's a non-selective beta blocker. And because it's a non-selective beta blocker, this medicine can block both beta 1 and beta 2 receptor. So drug can block beta 1 and beta 2 receptor. And because this medicine can block beta 2 receptor, medicine can result in bronchoconstriction. So try to understand the clinical aspect of this question. Although you are using this medicine in the form of eye drops, but because of lipid solubility, this drug will be absorbed in your systemic circulation. And after reaching the systemic circulation, this medicine can act on beta receptors present over bronchioles and can result in bronchoconstriction. So any patient who is a case of bronchial asthma, if that person is using timolol drug, which is a non-selective beta blocker, there is a risk of precipitation of bronchial asthma symptoms. So it is generally avoided in such type of patients. And as a doctor, if you want to prescribe any beta blocker anti-glaucoma medication to such type of patients who have glaucoma with bronchial asthma, it's better to give bitoxolol. So bitoxolol is a drug which is a selective beta blocker. This medicine has no action on beta 2 receptor. So in such type of patients who have this risk of bronchoconstriction, we should be giving bitoxolol, not the timolol. So question number 1, answer is timolol. And if we talk about other options, pilocarpine is a meiotic drug, right? Second is cartiolol. So pilocarpine is a drug which is generally used during emergencies. So whenever patient has acute attack of glaucoma, we generally use pilocarpine during that time. So answer can be pilocarpine in this question, but the chances are less because the drug usage for the drug chronic usage is not clinically very common. That's why the better answer is timolol followed by pilocarpine. Other options, cartiolol, brimonidine, all these medicines are other anti-glaucoma drugs which have no relation with bronchoconstriction. So best answer, question number 1 is timolol. Yes, so Dr. Govinda Adhikari from Nepal, Dr. Navrang Dutt. Welcome to this session. So guys, if you have any other feedback, just let me know. I'll discuss that also. Now, according to some students, there was a similar questions which was based on anti-glaucoma drugs, and that patient is also having bronchial asthma. So patient is having glaucoma and having the bronchial asthma. Again, there was one more question: which of the following anti-glaucoma drug is avoided in this patient? Now, in this question, the options are changed, and there is a drug bimetoprost. So bimetoprost, and according to Dr. Navrang Dutt, latanoprost was there. So not the bimetoprost, latanoprost was there. So these are the prostaglandin analogs, and prostaglandin analogs are the medicines. Prostaglandin analogs are the medicines. When they get absorbed in systemic circulation, can result in bronchoconstriction. Although the risk is very low, there are very few cases which have been reported. The risk is very low, even very, very less risk in comparison to timolol. Because as per some students who have given the feedback, there was only one question, and in that question, both bimetoprost and timolol was there. So even if there is a choice, better answer is timolol, right? So timolol was there. If timolol, bimetoprost, both are there in the option, better answer is timolol. Second best answer is bimetoprost. Third best answer is then pilocarpine, right? Rest of the medicines are all anti-glaucoma drugs, like brinzolamide is carbonic anhydrase inhibitor, brimonidine is alpha-2 agonist. Brimonidine can cause respiratory suppression but has no effect on bronchioles. This medicine acts on central nervous system. That's why it's not the best answer to be chosen for this question number 2. So question number 1, the answer was timolol if bimetoprost is not there. Question number 2, in this case, if timolol is not there, bimetoprost is the second best answer. And if both drugs are there in the paper, best answer is again timolol followed by bimetoprost. Yes, Dr. Abhishek Yadav has said there was only one question. So Dr. Abhishek Yadav, we have discussed these two questions in all ways, right? So in all manners, we have discussed this question. I think you have got your answer. Question number 3. So question number 3 is based on 29-year-old lady who is a smoker and is on nicotine therapy for de-addiction. So we know that any patient who is an addict of nicotine, the best treatment for nicotine de-addiction is nicotine therapy in the form of skin patch. So we discussed this concept during our top 25 clinical questions of pharmacology. That I gave you one table that drug de-addiction topic is very important. Every year one question is asked. So this year they have asked question on smoking de-addiction. So female is on nicotine de-addiction therapy. Now she wants some alternative therapy. I don't know what exactly the statement was, but some students have given the feedback. They have asked about the alternative therapy. Like female is not comfortable with nicotine therapy. She cannot tolerate this nicotine therapy. Now she wants the alternative therapy, which of the following drug is useful. So in this question, according to students, vanicillin drug was there. So please remember, for nicotine de-addiction, we discussed 3 important things during our lecture. One is the nicotine in the form of skin patch. This is the best therapy for nicotine de-addiction. Second best option is vanicillin, which can also be given. And the third is bupropion. So bupropion is a third medicine which can also be prescribed to patients who are addict of nicotine, right? And can be given for de-addiction. Now flumazenil is a totally different drug which is used as a benzodiazepine antagonist. So this medicine is benzodiazepine antagonist, no relation with nicotine. Acamprosate and naltrexone. These medicines have their role in alcohol de-addiction. So these medicines have their role in nicotine alcohol de-addiction, and naltrexone also has its role in opioid de-addiction. So acamprosate is only for alcohol, naltrexone is for both alcohol as well as for opioid. So the best answer is C. So students, I want active participation from your side. Are these 4 options were there or not? As per the feedback, these 4 options were there, and vanicillin was the best answer out of these 4. So answer is C. Opioid. Okay, one option was opioid. Which opium? Okay, one option was opium. No, you're just answering my questions. Okay, right. So let's move on to question number 4. Question number 4. A patient suffering from bronchial asthma. So this time they have asked so many questions from bronchial asthma. So patient suffering from bronchial asthma comes to you in hospital. Right? All of the following drugs or the treatment modalities can be part of his management except. So in this question, students were very specific that they did not ask about acute or status asthmaticus. So did not say that it's acute bronchial asthma or status asthmaticus or it's an acute severe emergency of bronchial asthma. They just mentioned it's bronchial asthma. So patient suffering from bronchial asthma comes to you in hospital. All of the following drugs can be used in the treatment of this bronchial asthma except. So if we talk about these 4 options, although all these 4 options can be used for the treatment of bronchial asthma, but here IV magnesium sulfate. IV magnesium sulfate is the one which is mainly given whenever there is status asthmaticus or there is acute severe bronchial asthma. So this medicine is not a frontline drug. So if we go by the concept that we have to rule out the drug which is not a frontline drug, so magnesium sulfate is the best answer. So out of these 4, magnesium sulfate is a least commonly used medicine. We know that for bronchial asthma, we have to give salbutamol by nebulization. And during that nebulization of salbutamol, we also attach the oxygen line with it. The oxygen therapy is also given. And there is a role of steroid also so that there is no recurrence of bronchial asthma. So for acute asthma attack, we generally give steroids, salbutamol, and for also give oxygen therapy. Magnesium sulfate role only comes whenever there is acute severe bronchial asthma or it's a status asthmaticus. So answer of question number 4 is D, Delhi. So if there is any other option, please just let me know. Dr. Dipender Singh, Dr. Navrang, God level doctor. Good name, God level doctor. So question number 4, answer was D. If these were the 4 options. If the options were different, we can modify the answer as per your feedback. So give me the inputs of these options. I am again displaying these questions. Question number 1 was based on anti-glaucoma drugs. Question number 2 was again based on anti-glaucoma drugs. Question number 3 is based on smoking de-addiction, where vanicillin was the answer. Question number 4 was based on treatment of bronchial asthma, where magnesium sulfate is comparatively less commonly used than the other modalities given in this question. Question number 5. Now, patient with bladder cancer. A patient with bladder cancer on chemotherapy drugs. So, patient suffering from bladder cancer taking chemotherapy drugs, and that patient is also a case of CKD. So, patient of bladder cancer, also a case of chronic kidney disease. Now, this patient was on chemotherapy drugs, and you people must be knowing, whenever we give chemotherapy agents, patient develop tumor lysis syndrome. So, chemotherapy drugs will destroy the cancer cells, and when these cancer cells are destroyed in large number, this will lead to the spillage of purines in the plasma. So, all cells contains purine. So, whenever you destroy any cell, this purines will come out in the plasma, and these purines will undergo the metabolic pathways, and the end product is uric acid. So in tumor lysis syndrome, lot of uric acid will accumulate in the plasma, and that will lead to symptoms. So patient of CKD, so uric acid cannot be eliminated by the body because patient kidney is not functioning. Patient is taking chemotherapy drugs also. Patient develop tumor lysis syndrome because of the destruction of cancer cells, and that will lead to accumulation of uric acid, excessive uric acid in the plasma. So which of the following drug can provide fastest reduction? Can provide fastest reduction of uric acid level? So which of the following drug can provide fastest reduction of uric acid level? So what's the answer? There is some problem in the screen from my side. Till that time, you please answer this question. Right. So, yes, the answer is D here. Very good. So, answer is resp uricase. So, please remember uricase. Uricase is an enzyme. Uricase is a name of an enzyme. Uricase is the name of an enzyme that can cause breaking down of uric acid. Please remember, students, in human body, whenever uric acid is formed, this uric acid is eliminated by kidney. We human cannot metabolize uric acid because human body is deficient of uricase enzyme. Uricase enzyme is present or mainly seen in animals. So what we can do, any patient who has very high level of uric acid in plasma, we give artificial enzymes of animals to these patients, and now this enzyme will cause breaking down of uric acid and will give immediate relief to the patient. So any patient who has developed tumor lysis syndrome, which has very high level of uric acid, we have to provide immediate relief to this patient. We have to provide the fast relief to this patient. We have to do the immediate breaking down of this uric acid. So this is done by resp uricase enzyme. So question number 5, answer is resp uricase. Now, if the question is not this, question is something else. They have asked the drug of choice for hyperuricemia, or they have asked the drug of choice for tumor lysis syndrome. So please remember, drug of choice for tumor lysis syndrome is allopurinol. So even in patients of CKD, allopurinol is the best answer to be marked. So allopurinol is overall best medicine for the treatment of tumor lysis syndrome. What we generally do, whenever patient is suffering from cancer and we start chemotherapy drugs or radiotherapy we give, we know that there is a risk of tumor lysis syndrome. So on precautionary basis, on prophylactic basis, we give allopurinol along with this chemotherapy or radiotherapy so that patient will not develop tumor lysis syndrome. So you people can say that allopurinol is generally given for prophylaxis. Second, we can give febuxostat, but the better answer is allopurinol. But for the fastest relief, if the tumor lysis syndrome is already started, then which drug can provide the relief? Answer is resp uricase. So question number 5, answer is D Delhi, resp uricase. So if you have any doubt here, you can ask me, Dr. Bharul, Dr. Niyasat Ali, Dr. Rahul, Dipender Singh Chahal. If you have any doubt, please ask me right now. Or if you have any input over here, if you can say that, sir, this option is not there, there was something else. So we can discuss that also. So question number 5, the answer is resp uricase. Now moving on to question number 6. A 28-year-old female with first trimester pregnancy comes to you in hospital with high level of T3 and T4. So this female is suffering from hyperthyroidism. So females suffer from hyperthyroidism. Now which of the following drug is most appropriate to use in this female? So what's the condition given? The condition is female is pregnant and she is in first trimester of pregnancy. Now we have to treat this hyperthyroidism with a drug which is safe to use in first trimester. So drug which is given for hyperthyroidism and safe to use in first trimester, the best answer is propylthiouracil. Now this concept we have discussed so many times during our lecture, as well as we have covered this concept during our test and discussion. So I don't think so any student of MIST marked this question as a wrong question. So all students must be knowing the answer. The answer is propylthiouracil. So what we generally do, in first trimester we give propylthiouracil, and in second and third trimester, because of the risk of hepatotoxicity caused by propylthiouracil, we generally put patient on carbimazole or methimazole, whatever options are given in a question. So in this case, question number 6, the best answer which is safe to use in first trimester is propylthiouracil. Dr. Daffy DF, you typed some message, but after that you deleted that. Can you please type it again? Because I think you have given some input on the previous question of tumor lysis syndrome. Dr. Daffy DF, please give me the statement which you wanted to discuss. Don't keep your doubts with yourself. Discuss with me also. Give your tensions to me. I'm here to solve those problems. Yes, Dr. Khalnayak, answer is B, Bombay. Adrenaline, answer is propylthiouracil. Right. So question number 7, moving on to question number 7. So no doubt about that. We have discussed, we have predicted that questions will be asked from hematology, and this time there were 3 questions from hematology. So question number 7, a 28-year-old female with history of hypercoagulative disorder visiting OPD for anticoagulation treatment. Which of the following drugs should be avoided in first trimester of pregnancy? So which drug should be avoided in first trimester of pregnancy? This question was comparatively easy. So this question was comparatively easy and straightforward in comparison to the question which was asked in your last exam. So last exam they asked about the guidelines, but this time they just asked which drug is safe, which drug is unsafe to use. Right? So in this question, enoxaparin, any drug that ends with parin is heparin, and we know that the safest drug, safest anticoagulant in pregnancy is heparin. So all 3 options are heparin, the first one, the second, and the fourth one. Warfarin is avoided. So warfarin is a drug when given to pregnant female in first trimester. This medicine can cause Contradi syndrome. So we discussed that the risk of Contradi syndrome is very high. So Contradi syndrome can cause problem of chondrocyte. So warfarin is a drug that is avoided during the first trimester of pregnancy. Now there are some inputs coming from your end. I am really happy to see that you people are giving the inputs. Actually, for a teacher, the best motivation is when you people participate with me in the lecture. So the God level doctor, sorry. So according to him, in the previous question, they did not ask. In the question of tumor lysis syndrome, they did not ask about the fastest reduction. They did not ask about the fastest reduction of uric acid level. So if they did not ask the fastest reduction of uric acid level, and they just asked like which drug is the best drug for tumor lysis syndrome in a patient of CKD, so my suggestion is go for allopurinol. So allopurinol would be the answer if they did not ask about the fastest reduction. But they ask about the fastest reduction, which we generally use in clinics. So patient of tumor lysis syndrome, if the statement is based that patient has already developed tumor lysis syndrome, then allopurinol has no role. Because allopurinol is a drug which prevent uric acid synthesis. But if a patient has already developed tumor lysis syndrome, it means patient is getting the symptoms. So better to give a drug that can treat the symptoms, can provide the relief. So in that case, respiricase is the answer. So doctors, according to the question. Okay, so according to Dr. Defi DF, the question was a patient with tumor lysis syndrome with high level of uric acid, which drug is given to prevent renal failure? So which medicine we can use to prevent renal failure? Okay, so it means we have to choose a medicine out of these 4 which can prevent renal failure. So then doctor answer is respiricase. So the medicine which can prevent the complications of tumor lysis syndrome. Medicine that can prevent complications of tumor lysis syndrome, because one of the aspects of tumor lysis syndrome is this can affect the kidney. So in that case, respiricase will be the answer. So according to the statement, you have to give the answer. Right? So in this question number 5, if the question is which drug can prevent renal failure, which drug can prevent the complications of tumor lysis syndrome, it means patient has already developed TLS and now you have to prevent the complication, you have to treat the patient, you have to stabilize the patient. So in that case, respiricase is the best treatment to be used. Okay, according to Dr. Abhishek Yadav, the question was a patient with tumor lysis syndrome with high uric acid level, which drug is given to reduce the uric acid level? So again, the answer is respiricase. Because doctor, respiricase is a drug which is an enzyme which can cause breaking down of uric acid. So breaking down of uric acid is done by respiricase. There is no other drug which can cause this. Only uricase enzyme analogs can do this action. So again, the answer is resp-uricase. I think like if I would be the examiner, I would have put question on resp-uricase only, because all students know that allopurinol is the drug of choice for TLS, but this time they have asked about the treatment of TLS. So for treatment of TLS, resp-uricase is the best medicine to be given, right? So question number 5, the best answer according to me is resp-uricase. Question number 6 is propylthiouracil, the drug which is safe to use in first trimester of pregnancy. Next is question number 7. Question number 7 is warfarin. Warfarin is avoided in first trimester of pregnancy because of the risk of Contradi syndrome. Rest of the options I am a bit doubtful. So according to some students, all other three options were based on heparin, but I still doubt this fact. Can you please help me out in this? So I request you to please give your input. Please enter in the conversation, enter your discussion and give the inputs. What were the other options in this question? They've asked about the anticoagulant which is not used in first trimester of pregnancy. Answer is clear cut, it's warfarin. But what about the other options? One was heparin, I know that. What were the other two options? According to one student, it was all heparin in all other three options. Okay, according to Dr. Iqbal Ali, it's heparin only. Right. Okay, so according to Dr. Abhishek Yadav, this first B and D options were definitely there. Third, he does not know. Okay, no problem. So answer is warfarin, right? Okay, moving on to question number 8. So there was a straightforward question, I think, according to some students, where they have asked about the treatment of Legionella infection. So Legionella is a bacteria, can result in pneumonia, right? Okay, here comes the input. So God level doctor has given the input. One option was apixaban. So one option was apixaban. It was not enoxaparin. So instead of enoxaparin, the option was apixaban. So doctor, even apixaban is not used in pregnancy. Apixaban is not used in pregnancy, but now there is a catch over here. If we talk about factor 10 inhibitors, and we have to give this factor 10 inhibitors to pregnant female, if we have to choose one drug, apixaban is the best choice out of all, right? There's a catch here, right? So warfarin is definitely a teratogenic drug which is avoided. Now apixaban is a medicine which is having the word XA, ban. It's a factor 10 inhibitors. So all these factor 10 inhibitors are avoided in pregnancy. Now this is quite bit, I will say this is a bit difficult question. All factor 10A inhibitors are avoided in pregnancy, but still if we talk about the clinical trials which are available, there is only one drug which is so far tried in a pregnancy, and there is no worse outcome has been noticed in those clinical trials. The drug is apixaban. So, if you people know this fact, then you would have marked warfarin as the best answer. And even if you don't know about this fact, so you people must be knowing that warfarin is not a safe drug to use. So warfarin is the best answer out of all. So next is Legionella infection. So Legionella bacteria can cause pneumonia, and they've asked about the best medicine for the treatment of Legionella. The best answer is azithromycin. So azithromycin and fluoroquinolones like ciprofloxacin, levofloxacin. So azithromycin, ciprofloxacin, levofloxacin are the medicines which are generally used for the treatment of Legionella infection. So the patient has come to you with pneumonia, community-acquired pneumonia due to Legionella infection. Azithromycin, levofloxacin would be the best answer to be chosen. But please help me out here. Was the question based on hospital-acquired infection or ventilator-associated pneumonia or just a pneumonia? Please help me out in this. Because if the question is based on hospital-acquired infection or if the question is based on ventilator-associated pneumonia due to Legionella, then the answer might be different. But if nothing was there, they just ask about the best treatment for Legionella. It is azithromycin. or the second best answer can be levofloxacin, which is not here in this question. Right. Okay, it was just pneumonia. So Dr. Vatsal Tonk has given the answer, just pneumonia. Dr. Arlene Kaur also has given the answer. It was just pneumonia. Okay, it was only Legionella, no pneumonia, nothing was there. Okay, fine, doctor. It's an easy question, straightforward question. They just asked about the drug of choice for Legionnaires disease. So the answer is azithromycin, levofloxacin. Question number 8. Question number 9. A patient suffering from breast cancer is on chemotherapy drugs, taking multiple anti-cancer drugs. Now, patient cancer is not responding to low dose therapy of anti-cancer drugs. So, when the cancer is not responding to low dose therapy, there is a need to increase the dose. So, you have increased the dose of the chemotherapy agents. Now, which of the following drug requires monitoring of organ function when you increase the dose of the medicine? So, there is a drug over here which is bit toxic drug. According to some students, methotrexate was also there in the option. So please confirm whether methotrexate was there or not. Methotrexate was there or not. So if these three options were there, no doubt cisplatin is the answer, because cisplatin is a drug which can cause nephrotoxicity, which can cause ototoxicity and other problems. So this medicine requires monitoring when you increase the dose. So please confirm whether methotrexate was there or not. And what are the other options I should ask? Okay, there was a drug ifosfamide. So there was a drug ifosfamide. Okay, one was methotrexate, one was cisplatin, and what was the other option, the fourth option? And which organ function monitoring they have asked, or they have just asked in a generalized way, like which drug requires monitoring, or they mention some organ. Okay, now here comes the feedback from Dr. Litt. Nephrotoxic. So they asked about the nephrotoxicity. Okay, doctor, if they have asked about the nephrotoxicity and methotrexate was there, so I think the answer is methotrexate then. Because there are few drugs which require therapeutic drug monitoring, and the drugs which require therapeutic drug monitoring, some special drugs are there. One is methotrexate. So methotrexate monitoring is required whenever there is a risk of kidney damage, or whenever kidney is not functioning properly, methotrexate monitoring is required. Okay, according to Dr. Nikhil, they have asked about the drug which we should avoid to be given along with radiotherapy. The drug that we should avoid with radiotherapy. So the patient is taking a drug and radiotherapy is going on. So they asked which drug is avoided along with radiotherapy. Which drug is avoided along with radiotherapy? Is this so? Was this the question? Okay, there was one option of gemcitabine. Gemcitabine. Okay, so these were the four options: methotrexate, cisplatin, ifosfamide, and gemcitabine. These four options were there. 5-fluorosil was not there. So now the problem is whether nephrotoxicity they have asked or not. Because if they are asked about the nephrotoxicity, then okay, we have discussed actually all aspects of this question. This question is based on urinary bladder cancer, not the breast. It's a typo error. I have told them to write about the bladder cancer, but they have typed it as breast cancer. It's a bladder cancer, no doubt. Okay, doctor. So patient who has bladder cancer, you are increasing the dose of the medicine. Actually, now exact question we don't know. There is one possibility. If the patient is having bladder cancer, then ifosfamide is a drug which can cause hemorrhagic cystitis. So ifosfamide is a medicine. When given in a higher dose, this medicine can cause hemorrhagic cystitis, and because this medicine can cause hemorrhagic cystitis, this complication can increase the further risk of bladder cancer. So further risk of bladder cancer can be increased if you use high dose of ifosfamide. Right? First thing. Second, they can ask about the radiosensitizer drugs. They can ask about the radiosensitive drugs. Right? So out of these, gemcitabine can be the answer if they have asked about the radiosensitive drugs. Right? Cisplatin can also be the answer. But if they asked about the nephrotoxicity, then methotrexate will be the answer. Right? So this totally depends on the question. It's a bladder cancer. Right? So ifosfamide should not be given in a higher dose because this medicine can cause hemorrhagic cystitis, which can further increase the risk of cancer. Right? Gemcitabine is a drug which is a radiosensitizer. Methotrexate is a medicine that requires monitoring in cases where kidney is not functional. So that totally depends on the question which was asked. I have discussed all aspects of this question. Let's move on to question number 10. So question number 10, a young male patient who has family history of bipolar disorder in his father has now come to you in OPD with symptoms of mania. His genetic testing shows positivity for recessive inheritance of the genes involved in mania. Now, which of the following mood stabilizer can be given him as most effective treatment? According to some students, this question was based on prophylaxis. So they've asked about the best drug for prophylaxis or the treatment. So in this case, the best answer is lithium. So lithium is the best answer to mark over here. For prophylaxis, if they have asked, again the answer lithium. Overall, best medicine for bipolar disorder is lithium. Right? So lithium is the best answer. Here. Yes, the question is same. Thanks for the confirmation, Dr. Medico. Yes, Dr. Manoj. Dr. Siddheshwar Ladda. Any input in this question? Is if everyone has marked lithium, it means you are marked it correctly. They've asked about the prophylaxis or they've asked about the treatment. Yes, valproic acid. So valproic acid means valproate. Sodium valproate is also there in the option. So best answer is lithium. Question number 11. A patient of myocardial infarction taking aspirin tablet 325 milligram as an antiplatelet drug. Now, which other drug can be added to the above treatment to enhance the antiplatelet activity? Okay. So, in the previous question, they have given the history of 3 episodes. They have given the history of 3 episodes. Third episode. Is it a third episode or the 3 episodes? Because if there is more than 4 episodes, then we call it rapid cycling bipolar disorder. And for rapid cycling bipolar disorder, we have to give sodium valproate for the treatment of that. Okay. Instead of carbamazepine, lamotrigine. Instead of carbamazepine, lamotrigine was there. If the episodes are more than 4, it's a rapid cycling bipolar disorder. Okay, so patient has come to you with third episode and they have given the history that patient has already taken the treatment and that medicine is providing the mood stabilization to the patient. So out of these four, best mood stabilizer is still lithium. Best mood stabilizer is lithium here also. So again, answer will remain same. Answer will remain same. It's lithium. It's not going to be changed. So next is patient is taking aspirin tablet 325 milligram. So this question is based on antiplatelet drug guidelines. So we discussed these guidelines during our lecture that whenever we have to give antiplatelet drugs, it's better to give 2 antiplatelet drugs. So after MI, we have to give 2 antiplatelet medicines together, at least minimum for 1 year. So minimum for 1 year, we have to give 2 antiplatelet drugs. So in this case, warfarin is not antiplatelet, it's anticoagulant. Heparin is not antiplatelet, it's anticoagulant. Clopidogrel is the best answer to be marked. Dipyridamole is a drug which can cause coronary steal phenomena. And because this medicine can cause coronary steal phenomena, we generally do not use this medicine in patients of MI. We generally do not use this medicine for the patients of MI. We give dipyridamole mainly for stroke patients. So in this case, clopidogrel is the medicine that we can give along with aspirin to have more antiplatelet effect. Right? And clopidogrel is a drug which is ADP receptor inhibitor. This medicine is ADP receptor inhibitor. The name of the receptor is P2Y12 receptor. The name of the receptor is P2Y12 receptor. We discussed this thing during our lecture also. Right? Okay. According to Dr. Meghna, the patient was female. So female patient was there. Right? And the patient was having non-ST elevated MI. Patient was having non-ST elevated MI. Patient was female patient. Female patient having MI taking aspirin tablet. Which other drug we can give along with it to have the more antiplatelet effect? The answer was clopidogrel, which is a ADP receptor inhibitor or inhibitor of P2Y12. The name of the receptor is P2Y12. Now the third question which was asked from hematology, because I told you hematology is very important topic, was based on mechanism of action of aspirin. So question was based on mechanism of action of aspirin. So what is the mechanism of action of aspirin in patients suffering from thrombosis? Right? Yes. So clopidogrel is ADP inhibitor in the previous question. Okay, I think there were 2 questions and I got a feedback in which these 2 questions were mixed. So one question was based on mechanism of action of aspirin. And we discussed mechanism of action of aspirin in so much details and so many times during our lecture that I don't think so you people have marked it incorrect. So aspirin mechanism of action we discussed so many times during our lecture. I don't know the 4th option here, but the 3rd is the best answer. Inhibition of cyclooxygenase 1 enzyme. So antiplatelet action. So this medicine is antiplatelet drug. So according to some students, antiplatelet word was also given. So it's an antiplatelet medicine which is inhibitor of cyclooxygenase enzyme. Inhibitor of cyclooxygenase enzyme. And in a previous question was based on non-ST elevated MI. And one of the option was streptokinase here. But still doctor, the answer will remain same. Clopidogrel is an antiplatelet drug which is ADP inhibitor or P2Y12 inhibitor. I know that doctor, they did not mention the direct mechanism of action. I know that. But exact question feedback, I did not get it. So that's why I have put this question like this way. Okay. So question was, patient is taking aspirin 325 milligram and they have asked why patient is taking aspirin, like what this aspirin can do. So aspirin can do antiplatelet action. Aspirin can do antiplatelet action by inhibition of COX-1 enzyme. This was the answer. Right? So I think most of you have marked these questions correctly because these things we discussed so many times during our lecture. I'm so happy to see that, I mean, whatever we have predicted during our top 25 series, as well as which we predict, whatever questions we predicted during our lecture. So all these things were asked in exam, except for 1 or 2 questions which are misfired. But that's, quite obvious. You cannot predict all 100% questions. Now let's move on to the next question, which was quite easy. which is the best drug for the treatment of Raynaud's phenomena. So as per the feedback which I have got from the student, this topic is covered so many times in surgery class. So Dr. Vineet must have covered this topic, the best medicine for Raynaud's phenomena. It's a calcium channel blocker. So calcium channel blocker is the best medicine for Raynaud's phenomena. Right? Yes, answer is A, calcium channel blockers. Yes, all of you have marked it correctly. Next is, I want input from you people for this question, because still I am unable to get the exact clinical history and exact options they have asked in this tamoxifen. So I specifically mentioned during my lecture that SERM topic is very, very important topic. Every year they asked one question, and even this year also they've asked question on tamoxifen. So every year you get one question from tamoxifen. We predicted, and the question is in front of you, but I don't know what exactly they have asked. So this is here, they have asked about the tamoxifen side effect, and the answer was uterine cancer or endometrial hyperplasia. Yes, so answer they have given endometrial cancer or endometrial hyperplasia. So this was the answer, which is a side effect of tamoxifen. But what were the other options, doctor? Okay, Dr. Arlene Kaur, in the previous question, they haven't given the exact Raynaud's phenomena, they have given the clinical case. So one clinical case of Raynaud's phenomena was given, which was easy to diagnose. So it was calcium channel blocker. Right. So question number 14, answer is endometrial cancer. But what are the other options, that I don't know. So please remember, tamoxifen cannot cause osteoporosis because this medicine has positive effect on the bone growth. It cannot cause osteoporosis. Tamoxifen is given for prophylaxis and treatment of breast cancer. So it cannot cause cancer in opposite breast. And the third is infertility. Tamoxifen cannot cause infertility also. So the best answer is C out of all these. Next is question number 15. A patient who has just recovered from COVID-19 infection comes to an OPD with black discoloration material in the nose and the posterior part of buccal cavity. He also gave history of using high dose of steroid therapy during his treatment of COVID-19. Now, which of the drug is most suitable drug for his treatment? That's a clear-cut case of mucormycosis. So, clear-cut case of mucormycosis was given to you, and they have asked about the drug of choice for mucormycosis, and I don't think so that any one of you have marked it incorrectly. It's a liposomal amphotericin B. So, liposomal amphotericin B is the best medicine for the treatment of mucormycosis. Okay, according to Dr. Litt, there was a question, why we add progesterone? Why we add progesterone along with estrogen in OCPs? So there was a question, why we add low dose of progesterone along with estrogen in OCP? The reason is, like, if you keep on giving estrogen therapy, assume female wants to avoid pregnancy and she is taking estrogen in high dose. Although she cannot conceive, no doubt about that, estrogen is a very, very good contraceptive agent. But the problem is this estrogen can cause growth of uterus and breast. So estrogen can increase the risk of breast cancer as well as the endometrial cancer. And some studies have shown association with ovarian cancer also. So progesterone is given in a low dose along with estrogen to avoid this risk of cancer in different organs. This is the main reason of giving progesterone along with estrogen. Right? Okay, in the previous question, instead of osteoporosis, they have given the option that tamoxifen can increase osteoblast activity. So yes, tamoxifen is inhibitor of osteoclast, and by inhibiting osteoclast, it can increase osteoblast activity. So not a direct answer, but indirectly we can say tamoxifen can increase osteoblast activity. right? Next question is, again, now we are coming up with the questions where I have got less feedback. So I need your inputs right now here. A patient who is undergoing spinal surgery developed very high blood pressure of 240 by 120 mmHg, which was the best medicine to manage this hypertensive crisis. So which drug is best medicine to manage intraoperative hypertensive crisis? So for intraoperative hypertensive crisis, which drug is the best medicine to manage the case? So the answer is nitroprusside. So this thing we have discussed so many times during our lecture. Best medicine is nitroprusside, which we can use for intraoperative hypertensive crisis. Okay. So if you can give me inputs on this question, because I know that this question was not the one which is exactly asked over there. Yes. So tamoxifen, that female is suffering from breast cancer. You have given tamoxifen. What can be the side effect? So answer of tamoxifen question is endometrial carcinoma. Okay, this question was not there. According to Dr. Dexil, there was an option of IV mannitol. Dr. Navrang, ये क्वेश्चन आया कि नहीं आया ये भी याद नहीं हमें तो. Okay, according to many students now, one of the option was IV mannitol. Okay, according to Dr. Divya, the question is, in hypertensive emergency, all of the following drugs can be used except. For hypertensive crisis, all of the medicine can be used except. Okay, the question is, all drugs can be used. All drugs can be used for hypertensive crisis except. So I told you that antihypertensive topic is very important, and the options were IV nitroprusside, IV ismolol, IV nifedipine, and the fourth is IV mannitol. So IV mannitol, IV nitroprusside, IV ismolol, IV mannitol. So which drug is not used? So which drug is not given for hypertensive crisis? Okay. Yes, in this case the answer is mannitol. So mannitol is a drug, IV mannitol is a drug which is generally not given for hypertensive crisis. It's a osmotic diuretic, and during our lecture also we did not discuss this medicine. And instead of nifedipine, they asked about the nicardipine. So they asked about the nicardipine. So nicardipine is the medicine which we use. Thanks for this feedback, because guys, I was not getting options of this question. So one was nicardipine, one was nitroprusside. So two options were there. Third option was ismolol, and the fourth option was mannitol. So they asked which medicine is not useful for hypertensive crisis. Which drug is not useful for hypertensive crisis? The best answer was mannitol. Mannitol is not used, right? Rest of the medicines are used. So many of you have, I can see that you have marked it correctly, or you are just answering over here. You have marked something else over there. I'm so happy to see you that you people know the answers and you people are actively participating in this discussion. Good. Okay, question number 17. A patient found roadside in an unconscious state with pinpoint pupil, heart rate 54 per minute, BP is 90 millimeter Hg, and his history reveals he is a drug addict. History reveals he is a drug addict. Which of the following drug he must have consumed? So which is a drug which he must have consumed? Yes, the answer is morphine. So morphine is a drug which is an opioid, and this medicines can cause pinpoint pupil. So this morphine or the opioid group of medicines can cause pinpoint pupil. So this can cause pinpoint pupil. Cocaine amphetamine are two medicines which can cause mydriasis. So instead of pinpoint pupil, cocaine and amphetamine can cause mydriasis. So only morphine here can cause pinpoint pupil. Even haloperidol is a drug. If we consider that it's an antipsychotic and having the anticholinergic property, can cause mydriasis. But pinpoint pupil is characteristic feature of a morphine. So answer is B, Bombay. Right? Okay, in previous question, there was so much of discussion. I'm writing this question again for you people, the previous one. I'm writing this question again for you. So, according to some student, they have asked, patient is suffering from hypertensive crisis with cerebral edema. Patient is suffering from hypertensive crisis with cerebral edema. So, which of the drug is not useful? Which of the drug is not useful for the treatment of this? So, which of the drug is not useful for the treatment of this? The first option was nitroprusside. The second option was nicardipine. The third option was mannitol. And the fourth option was, according to some students, is labetalol or maybe it's esmolol. So this was the question, right? Right? So in this case, if the question was based on cerebral edema, with hypertensive crisis, guys, there is one exception of nitroprusside. That it should not be used in conditions where CNS is involved. Nitroprusside is a drug which can cause more harm to the CNS instead of benefit. So if cerebral edema or the cerebral problem was there, answer is nitroprusside. But if this was not there, they have just asked about this. They have given the BP 260 by 180, according to some students. Then here the answer is mannitol. Like we discussed the previous question, which drug is not useful, and there was no case of cerebral edema or CNS involvement. Then the answer was mannitol. But if the CNS में brain is involved, brain अगर involved है, तो answer होगा यहाँ nitroprusside. So totally depends on that. Okay. Yes, other antihypertensives can be used. This question was based on nitroprusside exception, basically. So generally we avoid using nitroprusside in patients who are having the CNS problem, because nitroprusside is a dilator of arteries and veins both. So it can increase the blood flow towards brain. It's a, very strong vasodilator and can cause problem, right? It can increase the edema further. So question number 16, question number 17 we have discussed. Now moving on to question number 18. A person with a snake bite around 8 hours ago, and at local hospital he has already got 10 vials of antivenom, but still patient is still having the symptoms. Rather, the symptoms are worsening. Neuroparalysis has started. What is the next step to do? So next step to do is we can give neostigmine plus atropine combination. We discussed so many times during our lecture that neostigmine is a kind of an antidote which is given along with venom. So neostigmine is the best answer over here. It's an easy question for you people, right? And Dr. Gaurav, please keep this question. We'll discuss in last, because I am not having this question which you have mentioned over here. And also there was one student who has mentioned a question based on antidepressant drugs, escitalopram. So doctor, I request you please mention that question again based on escitalopram in last, so that we'll discuss that question, right? So question number 18, answer is B, Bombay. Question number 19. A patient who has a long history of congestive heart failure but with maintained ejection fraction, with no signs of hypervolemia, comes to you with long QRS wave in ECG. So long QRS wave means patient is having hypertrophy. So patient is having hypertrophy of cardiac walls. So it's a cardiac remodeling. Now, which drug is the best drug to be given? Which drug is the best drug to be given to prolong the survival? So which drug is the best drug to be given to prolong the survival? So we discussed so many times during our lecture that drugs which are inhibitor of renin-angiotensin pathway. The drugs which are inhibitor of renin-angiotensin pathway are the best answer. So according to the students' feedback, lisinopril was there in option. So lisinopril was the answer. So we discussed this thing so many times during our lecture, as well as we discussed this during our top 25 questions. The medicines which can reduce the mortality or improve the survival of CHF patient, answer is lisinopril. Question number 20. A patient with hyperglycemia and positive ketone bodies in urine comes to you in hospital with altered sensorium. So it's a case of DKA. It's a diabetic ketoacidosis. Now, which of the following drug therapy is most suitable to start? So there was a question that what is the next step to do? So next step to do, you have to, check you have to do all these blood test, urine ketone level and everything. But there was a question, which is the best therapy to start, the most suitable therapy to start, right? So in this case, the IV insulin. So IV insulin in normal saline is the best treatment to start. So IV insulin we generally give for the treatment of diabetic ketoacidosis along with normal saline. Although we also give potassium chloride, the purpose of giving potassium chloride is like if you give insulin, this can cause hypokalemia. So insulin side effect is hypokalemia. So we give potassium chloride, and DKA patient also have electrolyte imbalance. So we have to treat that electrolyte imbalance also. So best answer is insulin over here. IV insulin along with normal saline. Right? There was some problem in my system. Give me 2 minutes. So in this question of DKA, so the question is based on, yes, the answer was IV, yes, insulin is given by IV route along with normal saline. We can also give potassium chloride if it was there. Yes, doctor, next step. Dr. Asta, there were 2 questions on DKA. One question was from your subject medicine, in which they asked what is the next step to do. So next step was, because in that question of next step, they did not give you the ketone positivity. So they did not give the ketone positivity, and in second question they gave you this ketone positivity. In first question they just give you the presentation of DKA, and they asked what is the next step to do. So that was the urine ketone body you will check, and in one of the question they asked what is the best management. Yes, so answer is yes, okay, IV. So we give, there was a one option of IV fluid with potassium. Okay, so insulin was not there. So if the insulin is not there, then the answer will be this. If the insulin is not there, the answer will be IV fluid with potassium. But if insulin is there, insulin with normal saline or insulin with IV fluid is the best answer. Okay, this was an easy question. Question number 21. Question number 21 was an easy question. They just asked the definition of LD50. So it's a 50% of animal mortality. We discussed so many times during our lecture. It's a lethal dose 50. So 50% mortality which is observed in animals which are exposed to the drugs. So 50% mortality observed in animals, right, which was exposed to the drugs. Doctor, in previous question, the potassium level was given or not? Because if potassium level is not given, you cannot give potassium chloride. There is a possibility that patient potassium is high, and if you give potassium, this can cause arrhythmias. So according to me, the answer is insulin only in the previous question. So LD50 stands for 50% mortality in animals which are exposed to drug. It is not the effect of drug. It is about the toxicity of a drug. And it's not the death of 50 animals. It's not the treatment of infection. Question number 22. A tourist has visited an Indian village, developed mild diarrhea, which later on found to be caused by E. coli. Which of the following is the most suitable drug to use in this patient? Doctor, there were two questions on DKA. In one of the questions, they asked about the next step of the treatment. So that question will be covered in your medicine subject, recall. In pharma, if they asked about the drug, then insulin would be the answer. Question number 22. A patient has gone to the village. So it's a traveler's diarrhea. It's a traveler's diarrhea. And please remember, drug of choice for traveler's diarrhea is fluoroquinolones. Drug of choice for traveler's diarrhea is fluoroquinolones. And if fluoroquinolones are not given in MCQ, you can go for rifaximin. So rifaximin is one of the antibiotic which we generally give for the treatment of traveler's diarrhea. So it's a traveler's diarrhea. Tourist has visited Indian village and developed mild diarrhea, which later on found to be caused by the bacteria, that is E. coli. So which drug is the most suitable drug to treat this traveler's diarrhea? So traveler's diarrhea is a type of, there are two types of traveler's diarrhea. One is infective, second is non-infective. So as per the history, which I have got the feedback from the student, it's an infective diarrhea. So for infective traveler's diarrhea, we give fluoroquinolones or rifaximin. And if they have just asked about the symptomatic relief, it's a mild case. So we can give loperamide also. So in this case, we can mark loperamide also if they just asked about the symptomatic relief. If it was infective, better answer is antibiotic. If the antibiotic name is there. If the antibiotic name is not there, it's a non-infective. Right? So if it is non-infective and antibiotic name is not there, the answer is loperamide. But if it is infective, you have to mark antibiotic. Right? Question number 23. A patient undergoing... Okay, again this question is repeated, I think. Okay, let's move on to question number 24. Which of the following statement is incorrect regarding organophosphate and carbamates? Okay, in previous question, if E. coli is not mentioned, it's a non-infective diarrhea. And for non-infective diarrhea, we give loperamide. It's a non-infective diarrhea. They just asked about the symptomatic relief and E. coli name was not mentioned. If E. coli is not mentioned, as per the Dr. Shivam Thakur, if E. coli is not mentioned, answer is loperamide. Answer is loperamide. Yes, Dr. Sandeep Moore, it's only traveler's diarrhea, no E. coli, antibiotic name was not there, answer is loperamide. So go for loperamide. If rifaximin name was not there, go for loperamide. Yes, it's a mild diarrhea. The case is typically saying it's a mild diarrhea. Right. Asked about the symptomatic relief. The loperamide is a drug which we can use. Question number 24. Which of the following statement is incorrect regarding carbamate and organophosphate poisoning? So this is easy question. Pralidoxime. So we discussed that oximes. Oximes starts with word letter O, and these medicines have a role in OP poisoning. Oximes have a role in OP poisoning. So Pralidoxime has no role in carbamate poisoning. So pralidoxime has no role in carbamate poisoning or carbamide poisoning, whatever is given over there. So this option was incorrect. So this option was incorrect regarding pralidoxime. So pralidoxime is mainly given for OP poisoning. Carbamates and organophosphates can inhibit acetylcholine esterase enzyme irreversibly. Atropine can be used as antidote of these poisoning. Right? So answer is C. Question number 25. A 70-year-old Parkinson's patient. Seventy-year-old Parkinson patient suffers from constipation after taking anti-Parkinsonism treatment. So 70-year-old Parkinson patient suffers from constipation after taking anti-Parkinsonism drug. Which drug might be responsible for these symptoms? So exact options are not there with me. So if any of these two drugs are given over there, can be the answer. So if they've given amantadine or benzoxazole, this can be the answer. So question number 25, answer can be amantadine or benzoxazole because these medicines have anticholinergic property. These medicines have anticholinergic property, and due to this anticholinergic property, medicines can cause constipation. And the same thing they've asked, the patient has developed constipation, so we should not use amantadine and benzoxazole in this patient. One of the option was selegiline. According to some students. So selegiline we can use, but amantadine, benzoxazole, if these options were there, yes, these options, if these medicines are avoided. These medicines are avoided because medicines can cause constipation as a side effect. Okay, selegiline I have added, doctors. Thanks for this input. Dr. Khalnayak, selegiline I have added. Next is question number 26. A patient taking the treatment for acne developed pigmentation of skin. So developed pigmentation of skin and it is induced by a drug. Okay. In previous question, instead of giving benzoxazole, they gave trihexyphenidyl. So doctor, it's the same thing. So trihexyphenidyl and benzoxazole. So I told you many a times during my lecture that anticholinergic drug side effects they ask. I specifically told you many a times that please remember the contraindications and side effects of anticholinergic drugs. Even this year they have asked this question. So benzoxazole, trihexyphenidyl, these are the anticholinergic medicines, can cause constipation very severely, so should not be used. Right? So Parkinson patient, okay, if the question is again based on Parkinson patient having open angle glaucoma, or if the question was based on constipation, it means they are asking about the anticholinergic side effect. And I mentioned so many times in our lecture that anticholinergic side effects and anticholinergic contraindications are very, very important. Every year they ask these questions either directly or indirectly. Right? So question number 26, they asked about the pigmentation side effect. The fourth option was erythromycin as per some students. So minocycline. Minocycline is a drug. This medicine accumulates in sweat glands and medicine can cause pigmentation of skin. So minocycline can cause pigmentation of skin as a side effect. Right? Okay, as per some students, they didn't ask about some drug-induced side effect. Because as per some students, they asked about a patient has developed drug-induced side effect. So which drug might be responsible for that? Drug-induced toxicity. So this question was based on drug-induced toxicity. Okay, this question was image-based. Okay, doctors, maybe this question might be image-based. Okay, if the question is image-based, then this question will go to the derma. So this question will go to derma if it's image-based, because by looking at the image, you have to make the diagnosis that it's a drug-induced erection. Because drug-induced erections mostly takes place on the extensor surface. So then you must have found the history is given. That's on extensor surface. Every time it is taking place at the same location of the body. Right? Yes, it's on the leg. So if they have given the history of leg, so it's on the extensor surface. And minocycline history is there. So it's a pigmentation of skin. It's a dermatology question, not a pharmacology question. So I'm deleting this question from this pharmacology. Happy now? Okay, there were some more questions like drugs for MTP. So I don't know the exact options which were there. So mifepristone, misoprostol was the answer. And there was a question which was based on retina. So bevacizumab, according to some student, was the answer. So bevacizumab is a drug that is given for the treatment of a diabetic proliferative retinopathy as well as given for age-related macular degeneration. So these questions were there. Now I request you from two doctors. One doctor mentioned a question based on escitalopram. Please tell me which question was this. Question based on escitalopram. Please mention this question. And also Dr. Gaurav, if you are there. Dr. Gaurav, if you are there, please tell me which question was asked. Yes, doctor. These two questions, I don't have any input on this because I don't have any options and question available with me. Okay. One question was on botulinum toxin. So botulinum toxin, a female patient having the wrinkled skin. So a female patient having the wrinkled skin, which drug is useful? So botulinum toxin was there. So botulinum toxin was there. So botulinum toxin is useful for wrinkled skin. We discussed many times. I told you specifically in the first session of my lecture, I always cover these anticholinergic side effects and botulinum toxin. I mentioned that this is important. Okay, the question is escitalopram is an SSRI. Escitalopram is an SSRI. Patient is taking this medicine. Still patient's symptoms are not getting controlled. So patient's symptoms are not getting controlled. What is the next step to do? Okay, there was a one question on lamotrigine side effect. So lamotrigine side effect. Okay, symptoms. So patient is taking SSRI, antidepressant medicine, but still patient symptoms are not getting control, which is the next step to do. So doctor, the best answer is add one more antidepressants. So generally, whenever we start SSRI therapy to a patient of depression, we generally start with the optimal dose. We do not start with the low dose. We generally start with the optimal dose which is required by this patient for the treatment. Then we wait for few weeks. If the patient's symptoms are not controlled, the next best step is to add one more antidepressant drug. So if the question was there, add one more antidepressant, then that was the answer. Lamotrigine side effect is hypersensitivity reactions. Lamotrigine side effect is hypersensitivity reaction. So if they have given you Stevens-Johnson syndrome or TEN as one of the option, so that would be the answer. Lamotrigine, डॉक्टर सुधीर हिंदी में बोलते हैं, अगर लेमोट्रिजिन पे क्वेश्चन था तो आंसर होगा हाइपर सेंसिटिविटी और एलर्जिक रिएक्शंस, बिकॉज लेमोट्रिजिन इज वन ऑफ द वेरी वेरी सेफ मेडिसिन which hardly causes any side effects. So hypersensitivity reactions are typically seen with lamotrigine. So अगर वहां पे hypersensitivity था तो that was the answer of that question. Okay, yes, one of the option was add TCA. So if the option was add TCA, so this can be the answer. So we can add other antidepressant, tricyclic antidepressants. Tricyclic antidepressants we can add. There was one more question. Okay. So, okay. So the opioid which has both, there was a question on opioid which has both opioid receptor as well as non-opioid mechanism. So opioid as well as non-opioid mechanism of action. So this is tramadol. So as per some students, it's tramadol was there. So tramadol is a drug which has a unique mechanism of action. This medicine can cause tachycardia, can has direct effect on heart. And also this medicine will act as a opioid, can be used as a painkiller. So this medicine has both type of action, opioid as well as non-opioid. Right? So one more question was, which NSAID is useful for rheumatoid arthritis? So which NSAID is useful for rheumatoid arthritis? So which NSAID is useful? Doctor, the options which you have given, the NSAID which is given for rheumatoid arthritis, one you have given as ketorolac, second you have given paracetamol, third you have given triamcinolone. So triamcinolone is a steroid, PCM is not a NSAID, so ketorolac is the best answer. So for rheumatoid arthritis, we have to give painkillers, so ketorolac can be the answer. Opioid which has both opioid as well as non-opioid mechanism, it's tramadol. So tramadol is a drug which has both opioid as well as non-opioid mechanism. So that is all from my side, doctors. So I hope you have enjoyed this short session of pharmacology recall questions. You people must be enjoying your life these days, but still the last message for you people, I really thankful to you people who have given me so much of inputs in recollecting all these questions and making this session successful. Without you people, we cannot do anything. It's only you are there. That's why we people are able to deliver so much. Always be there, be healthy, and I know that you are coming up with the flying colors in this exam. All the best, doctors. My wishes are with you. Enjoy the day.